We've come to appreciate in multiple myeloma what we do for newly diagnosed patients. Often we call it frontline therapy or their first therapy is actually really important in the long term because what we do at the very start impacts the life of the patient in the very long term. There was some extraordinary research presented at both ASCO and EHA in newly diagnosed multiple myeloma, and I want to dive a little bit deeper with you into 3 particular studies that I think are going to influence the way we think of and treat a newly diagnosed multiple myeloma. The first of which was the Perseus study. So for those of you who are aware of this, you may remember this because we've talked about Perseus before as being a very important clinical trial that compared giving 4 drugs to 3 drugs, where we added daratumumab to the standard VRD or Velcade, Revlimid, and dexamethasone combination. And this actually led to its approval and use in patients who are planning to go to an autologous stem cell transplant. Well, the updated research was later on in this clinical trial, where not only were patients given the 4 drugs up front and then a transplant, and then 4 drugs for a brief consolidation, now we're into the so-called maintenance phase of the study, where the comparison was giving 2 drugs with daratumumab and Revlimid versus Revlimid alone, which is really the standard of care now.